drive you. Have a nice night, Lisa. Oh. Okay, we're almost there.
Ow! It hurts so bad.
Okay, we're here. Come in. Hi, I'm your doctor.
Hi.
I hear that you hurt your leg.
Yeah, I fell off a skateboard. I ran into a jogger.
Well, you know how people are these days. It's crazy. So, I need to explain to you what happened.
Okay.
Okay.
Is it a sprain?
No, it is actually blah 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 blah. Do you understand that?
Okay.
Okay, good. Have a good day and life.
Come in.
Hi. So it looks like you are extremely troubled.
The doctor kind of explained the procedure to me, but I don't understand it. Could you elaborate or?
Okay, yeah, sure. So what you're getting is open reduction internal fixation, and it repairs fractures when they can't heal properly. And then the surgeon cleans the skin with an antiseptic, and then the broken bone is put back into place. And then they screw it in with a pin or a rod to hold the bone and the broken parts together. And then the whole incision is closed with staples or stitches, and then dressing is applied.
How long will it take?
It usually takes several hours, but it depends on how the fracture and the bone are involved.
How bad will it hurt?
It depends.
Erica, how are you feeling right now?
Good.
You feeling good? You don't feel any pain right now? Okay, so your surgery went really, really well. The doctor went in. He doesn't think that you're going to be in the hospital for 2 days, so you're going to get discharged today.
Okay.
So I just want to go over a few things with you. You think you can stay awake for this?
Yeah.
You can understand me? We're good?
Yeah.
Okay. So first of all, like activities, we want to limit any pressure that's going to be on your foot. So you're going to have the aid of crutches. Okay, so when you go home, you're going to use a lot of ice packs because we want to keep the swelling down. So if you don't have a lot of ice in your house, if you have frozen peas or a frozen bag of corn, stuff like that, we want to keep that at 15 minutes on, 15 minutes off.
Okay.
Also, we want to elevate your leg as much as possible. So we want to, put prop pillows under it, whatever is most comfortable
Should
for
I
you.
elevate it now?
It should be elevated now, and I don't know why it's not. So we'll fix that in a little bit here.
Yeah.
You're not driving. You have someone to drive you?
Yeah.
Okay, good. So big thing about your bandages on your foot, I don't want you to remove them until your next appointment with the doctor. He'll do all of that. So as far as like showers, those are eliminated. Baths, you're probably going to have to take a bath and keep your leg out.
Okay.
Sponge bath around there. So no taking off the Band-Aids. Right now for your diet, as you go home, you're going to be on a liquid diet because of the drugs that are still in your system. You might feel nauseous, you might feel dizzy, so we want to keep that down. Let's see what else the doctor wants me to go over. You're going to have crutches, so also you're not going to be in here for very long, but your doctor,
When am I going home?
when are you going home? Probably until the drugs wear off and we're able to get the discharge papers in order. So as far as physical therapy, you're going to need a lot of that, and it's very important that you stay on it because we want to get you back to where you were before. Skateboarding, staying away from strangers who steal skateboards, and so forth. And as far as medications, you need to take your pain medication every 4 hours. It's key. So, we're giving you a narcotic. You're getting Norco, which is 5 and 500. So you're getting 500 milligrams of Tylenol, basically.
Okay.
So it's going to help you with pain. Don't drink alcohol. It's very important. Do not drink alcohol. Or don't take anything else like Tylenol or any store brands because that's going to interfere. Let's see. Also take your medication with food. Your stomach's in it.
Sick.
Yeah. So physical therapy, we already talked about that. The doctor's going to make sure that gets set up. Like I already told you about your dressing and showering, and your follow-up care. We're also gonna, in about 5 days, we're gonna schedule you with Dr. Nissan again, and he's gonna remove your dressing. He's gonna look at your sutures and see if they need to be removed.
Shoot.
So you should be good to go. Okay. You have any further questions for me?
Not right now.
Okay.
Thank
Awesome.
you.
Looking at our patient, we want to do an assessment before surgery. We want to assess their cardiovascular system. Do they have, what am I looking for? Oh, do they have cap refill? Are they breathing properly without the aid of assistance of oxygen? You know, looking at their oxygen saturation, respiratory, and we want to look at their renal system. Can they urinate by themselves in an appropriate manner? And we also want to look at their liver functions because we are giving them anesthetics, so before surgery, anesthesia, I should say. And then during this whole thing, they're going to be, after surgery, they're going to be at risk for infection. And so it's really important that we're assessing our wounds, we're assessing for drainage, etc. And we also, after surgery, we want to promote early ambulation. We want to get them up out of their bed, start moving with the aid of physical therapy. If they're in the hospital that long, like our patient scenario, she was young, she was healthy, she got discharged. But older, we're looking at elderly. A lot of our patients that are going to be going through OR-IF are going to be elderly, and it's mostly going to be from a fall that they had. So it's really, really important that, we get their ambulation in there and we get them get them up and moving because their risk for independence is gone. Also, when they're in surgery, they're at risk for blood loss. So that's something we want to look for after when they come out of surgery. Also, we need to incorporate and really do an assessment on their home life. Do they have a caregiver? Are they independent by themselves? If not, we need to get social services in there and case management. That'd be really important for them to, one of the words I'm looking for, work together so they can promote their independence. Yeah,
Interventions for our post-op patient would be relieving pain, and we would do that through a pain scale, asking them to rate it 1 through 10. We would also do it through maintaining adequate neurovascular function, and we would want to make sure they don't have any tingling in their toes or their fingers, and if we found any abnormalities, we would have to let the doctor know immediately. We also want to promote their health, and we would do that through physical therapy, which also relates to improving their mobility. We would want them to get up and start walking, as soon as they can, but of course we need to give them that period of letting them heal. And we also want to help the patient maintain self-esteem. They have an altered body right now, but we need to let them know that that's only temporary, and if they continue to do their physical therapy, that they will get better.
Okay, so some of the expected patient outcomes for our patient would be that the patient will report relief of pain, and they can do this by using multiple approaches, like different medications and relaxation techniques. They should also exhibit adequate neurovascular function, and that would include things like normal skin color, warm skin, normal cap refill. They should also be able to promote health, and they would do this by abstaining from smoking and practicing breathing exercises and treatments, and then repositioning to relieve the skin pressure. And they will also maximize mobility by requesting assistance if they need help walking, and using immobilizing devices and assistive devices. And finally, they should express positive self-esteem, and they will participate in decisions about their own care, and acknowledge that they have some temporary or permanent changes in their body image.
Hi. Hello. Are you ready to do some nursing group projects? I think so. I don't know how to phone. That's perfect. That's perfect. Call 911.
Oh.